Organisasi yang baik sangat bergantung terhadap kehebatan orang-orangnya. Kita harus memiliki orang-orang yang bekerja di Kementerian Kesehatan jauh lebih hebat dibandingkan bukan hanya kementerian yang lain, tapi organisasi-organisasi lain yang ada di Indonesia. Itu sebabnya kenapa kita harus serius lagi membangun sumber daya manusia, dan itu merupakan pilar nomor 7 dari transformasi kita. Saya bilang, orang yang hebat itu punya budaya kerja dan budaya hidup yang berbeda dengan yang enggak. Yang saya ingin pesankan nomor 1, membangun manusia hebat itu sangat penting. Itu akan menentukan keberhasilan suatu organisasi. Yang nomor 2, manusia hebat itu kayak gimana? Itu yang punya budaya kerja yang hebat. Itu yang harus dibangun. Nomor 3, cara bangunnya gimana? Dilatih, bukan diajari saja. Harus dengan seorang mentor, bukan hanya seorang guru. Itu harus dilatih di tempat kerja, diberikan dalam bentuk contoh, dididik oleh seorang yang hebat budayanya, bukan orang yang hebat gelarnya. Saya ucapkan terima kasih ke teman-teman di Korpu ya, yang sudah membuat program yang menurut saya inovatif dan baru. Ibu dan Pak Bambang yang sudah membuat ini. Saya berharap benar-benar teman-teman nanti bisa mendapatkan ilmu dan contoh yang sebaik-baiknya dan bisa membangun budaya kerja yang hebat untuk menjadi insan-insan Kemenkes yang hebat dan bisa membawa Indonesia tidak kalah hebatnya dengan negara-negara lain.
Indonesia tengah mengalami periode bonus demografi yang terjadi hanya satu kali dalam peradaban sebuah negara. Kita harus memacu kinerja dengan cepat untuk memanfaatkan peluang ini sebagai momentum Indonesia lolos dari middle income trap, menjadi negara berpendapatan tinggi, serta mencapai visi Indonesia Emas 2045. Di sisi lain, COVID-19 membuka mata kita akan transformasi yang amat diperlukan di bidang kesehatan. Lebih dari 300.000 kematian akibat stroke setiap tahun, 4.000 bayi wafat karena kelainan jantung bawaan, 5 juta balita hidup dalam kondisi stunting. Rakyat Indonesia membutuhkan akses dan kualitas layanan kesehatan yang lebih baik.
Sesuai dengan amanat Undang-Undang Dasar 45, bahwa setiap orang berhak memperoleh pelayanan kesehatan dan negara bertanggung jawab atas penyediaan fasilitas kesehatan yang layak. Berdasarkan mandat itulah, Kementerian Kesehatan membentuk 6 pilar transformasi kesehatan yang menopang sistem kesehatan di Indonesia.
Transformasi layanan primer, dari fokus mengobati menjadi mencegah, mengedepankan layanan promotif dan preventif berdasarkan siklus hidup di layanan primer amatlah penting.
Agenda penting lainnya dalam transformasi layanan primer adalah peningkatan kapasitas dan kapabilitas layanan primer. Ini kita lakukan karena kita harus menjangkau seluruh masyarakat Indonesia yang jumlahnya 280 juta orang di wilayah yang sangat luas. kita lakukan melalui revitalisasi jejaring dan jaringan puskesmas, yaitu Pustu, Posyandu, kader yang nanti akan melakukan kunjungan rumah, juga dengan jejaring dengan FKTP lainnya.
Transformasi layanan primer untuk screening penyakit menular dan tidak menular yang menjadi prioritas untuk penyakit menular adalah TBC, HIV, dan malaria. Dalam pencegahan dan pengendalian penyakit tidak menular di tahun 2023 dilakukan perluasan screening faktor risiko PTM yang diimplementasikan dalam integrasi layanan primer dan menjadi bagian dari paket manfaat JKN.
Transformasi layanan rujukan dari akses layanan kesehatan yang susah menjadi mudah.
Dengan sistem rujukan berbasis kompetensi yang kami kembangkan, mulai dari tingkat kabupaten, kemudian provinsi, sampai dengan tingkat nasional, maka pelayanan-pelayanan terkait dengan kanker, jantung, stroke, urologi, dan kesehatan ibu anak bisa segera dinikmati oleh masyarakat kita, sehingga masyarakat tidak perlu berobat jauh-jauh hanya untuk mencari pelayanan prioritas tersebut. Dan ini kami persembahkan buat Indonesia.
Transformasi sistem ketahanan kesehatan dari industri kesehatan yang bergantung ke luar negeri menjadi mandiri di dalam negeri.
Melalui program transformasi ketahanan kesehatan, pemerintah terus berupaya memperkuat ekosistem industri farmasi dan alat kesehatan Indonesia, dimulai dari penelitian dan pengembangan, produksi, hingga jaminan pasar untuk penggunaan sediaan farmasi dan alat kesehatan dalam negeri.
Dari sistem kesehatan yang rentan di masa wabah menjadi tangguh. Diperlukan penguatan kesiapsiagaan pra-bencana dan penanggulangan secara terkoordinasi dengan melakukan penyiapan tenaga kesehatan yang sewaktu-waktu diperlukan dapat dimobilisasi saat terjadi bencana. Transformasi sistem pembiayaan kesehatan.
BKPK berperan aktif dalam menyukseskan pilar pembiayaan dalam agenda transformasi kesehatan. Tujuannya untuk memastikan dana yang tersedia untuk kesehatan cukup, teralokasi dengan baik, dan dapat dimanfaatkan sebesar-besarnya untuk seluruh lapisan masyarakat di Indonesia.
Dari pembiayaan yang tidak efisien menjadi transparan dan efektif. Penting untuk menerapkan penganggaran berbasis kinerja dengan mengacu pada program kesehatan nasional yang dituangkan dalam rencana induk bidang kesehatan yang menjadi pedoman yang jelas bagi pemerintah dan pemerintah daerah. Transformasi SDM Kesehatan.
Di tahun 2023, Kementerian Kesehatan bersama pemerintah daerah telah berhasil mengisi puskesmas untuk bisa memiliki dokter, di mana mencapai 96,84%. Dan puskesmas juga telah memiliki 9 jenis tenaga kesehatan yang mencapai 56,22%.
Dari tenaga kesehatan yang kurang menjadi cukup dan merata. Diperlukan percepatan produksi dan pemerataan jumlah dokter spesialis melalui penyelenggaraan pendidikan dokter spesialis berbasis kolegium dan rumah sakit. Dari perizinan yang rumit dan lama menjadi cepat, mudah, dan sederhana. Diperlukan penyederhanaan proses perizinan melalui penerbitan STR yang berlaku seumur hidup dengan kualitas yang terjaga. Dari tenaga kesehatan yang rentan dikriminalisasi menjadi dilindungi. Tenaga medis dan tenaga kesehatan memerlukan pelindungan hukum dalam melaksanakan tugasnya, baik dari tindak kekerasan, pelecehan, maupun perundungan. Transformasi teknologi kesehatan. Dari teknologi kesehatan yang berfragmentasi dan tertinggal menjadi terintegrasi dan maju.
Kita telah berhasil memastikan rekam medis elektronik diterapkan dan menggunakan standarisasi serta modul pada ekosistem Satu Sehat Platform. Lebih dari 22.000 pasienkes sudah terintegrasi dengan Satu Sehat Platform yang berstandar global dan memiliki sertifikat keamanan ISO 27001 dan 27799 yang diakui di lebih dari 100 negara.
Diperlukan akselerasi pemanfaatan teknologi biomedis untuk pelayanan kesehatan, termasuk pelayanan kedokteran presisi.
Melalui inovasi bioteknologi kesehatan, mari kita wujudkan kolaborasi ekosistem kesehatan yang inklusif dan peningkatan layanan kesehatan bagi masyarakat Indonesia.
Transformasi internal Kemenkes. Banyak hal yang telah dicapai Kemenkes sejak dijalankannya transformasi kesehatan. Capaian ini didukung melalui transformasi internal Kemenkes yang dilakukan oleh Internal Transformation Office. Sejumlah inisiatif jangka pendek telah dijalankan sejak tahun 2022. Dalam jangka panjang, upaya transformasi internal Kemenkes tidak hanya untuk meningkatkan kualitas dan efisiensi operasional Kemenkes, tetapi juga akan berkontribusi positif pada transformasi sektor kesehatan secara keseluruhan di Indonesia, serta menjadi sumber inspirasi dan pembelajaran bagi organisasi lain. Disahkannya Undang-Undang Kesehatan Nomor 17 Tahun 2023 merupakan awal yang baru untuk membangun kembali sistem kesehatan yang tangguh di seluruh Indonesia. Kemenkes mengajak seluruh elemen pemerintah pusat, pemerintah daerah, swasta maupun organisasi non-pemerintah untuk ikut membangun secara sinergis sampai seluruh penjuru negeri.
Mari kita didik masyarakat kita agar tetap sehat dan jauh dari segala macam penyakit untuk Indonesia emas di masa nanti 2045.
Melesat demi Indonesia Emas 2045. Kemenkes hebat, Indonesia sehat.
Bahwa organisasi yang baik sangat bergantung terhadap kehebatan orang-orangnya. Kita harus memiliki orang-orang yang bekerja di Kementerian Kesehatan jauh lebih hebat dibandingkan bukan hanya kementerian yang lain, tapi organisasi-organisasi lain yang ada di Indonesia. Itu sebabnya kenapa kita harus serius lagi membangun sumber daya manusia, dan itu merupakan pilar nomor 7 dari transformasi kita. Saya bilang, orang yang hebat itu punya budaya kerja dan budaya hidup yang berbeda dengan yang enggak. Yang saya ingin pesankan nomor 1, membangun manusia hebat itu sangat penting. Itu akan menentukan keberhasilan suatu organisasi. Yang nomor 2, manusia hebat itu kayak gimana? Itu yang punya budaya kerja yang hebat. Itu yang harus dibangun. Nomor 3, cara bangunnya gimana? Dilatih, bukan diajari saja. Harus dengan seorang mentor, bukan hanya seorang guru. Itu harus dilatih di tempat kerja, diberikan dalam bentuk contoh, dididik oleh seorang yang hebat budayanya, bukan orang yang hebat gelarnya. Saya ucapkan terima kasih ke teman-teman di Korku ya, yang sudah membuat program yang menurut saya inovatif dan baru. Ibu dan Pak Bambang yang sudah membuat ini. Saya berharap benar-benar teman-teman nanti bisa mendapatkan ilmu dan contoh yang sebaik-baiknya dan bisa membangun budaya kerja yang hebat untuk menjadi insan-insan Kemenkes yang hebat dan bisa membawa Indonesia tidak kalah hebatnya dengan negara-negara lain.
Indonesia tengah mengalami periode bonus demografi yang terjadi hanya satu kali dalam peradaban sebuah negara. Kita harus memacu kinerja dengan cepat untuk memanfaatkan peluang ini sebagai momentum Indonesia lolos dari middle income trap, menjadi negara berpendapatan tinggi, serta mencapai visi Indonesia Emas 2045. Di sisi lain, COVID-19 membuka mata kita akan transformasi yang amat diperlukan di bidang kesehatan. Lebih dari 300.000 kematian akibat stroke setiap tahun, 4.000 bayi wafat karena kelainan jantung bawaan, 5 juta balita hidup dalam kondisi stunting. Rakyat Indonesia membutuhkan akses dan kualitas layanan kesehatan yang lebih baik.
Sesuai dengan amanat Undang-Undang Dasar 45, bahwa setiap orang berhak memperoleh pelayanan kesehatan dan negara bertanggung jawab atas penyediaan fasilitas kesehatan yang layak. Berdasarkan mandat itulah, Kementerian Kesehatan membentuk 6 pilar transformasi kesehatan yang menopang sistem kesehatan di Indonesia.
Transformasi layanan primer, dari fokus mengobati menjadi mencegah, mengedepankan layanan promotif dan preventif berdasarkan siklus hidup di layanan primer amatlah penting.
Agenda penting lainnya dalam transformasi layanan primer adalah peningkatan kapasitas dan kapabilitas layanan primer. Ini kita lakukan karena kita harus menjangkau seluruh masyarakat Indonesia yang jumlahnya 280 juta orang di wilayah yang sangat luas. Kita lakukan melalui revitalisasi jejaring dan jaringan puskesmas, yaitu Pustu, Posyandu, kader yang nanti akan melakukan kunjungan rumah, juga dengan jejaring dengan FKTP lainnya.
Transformasi layanan primer untuk screening penyakit menular dan tidak menular yang menjadi prioritas untuk penyakit menular adalah TBC, HIV, dan malaria. Dalam pencegahan dan pengendalian penyakit tidak menular di tahun 2023 dilakukan perluasan screening faktor risiko PTM yang diimplementasikan dalam integrasi layanan primer dan menjadi bagian dari paket manfaat JKN.
Transformasi layanan rujukan. Dari akses layanan kesehatan yang susah menjadi mudah.
Dengan sistem rujukan berbasis kompetensi yang kami kembangkan, mulai dari tingkat kabupaten, kemudian provinsi, sampai dengan tingkat nasional, maka pelayanan-pelayanan terkait dengan kanker, jantung, stroke, urologi, dan kesehatan ibu anak bisa segera dinikmati oleh masyarakat kita, sehingga masyarakat tidak perlu berobat jauh-jauh hanya untuk mencari pelayanan prioritas tersebut. Dan ini kami persembahkan buat Indonesia.
Transformasi sistem ketahanan kesehatan. Dari industri kesehatan yang bergantung ke luar
kepada
negeri,
Bapak Ibu peserta ya, kami persilakan untuk dapat mengisi kursi yang lebih di depan terlebih dahulu sebelum kita memulai acara kita pada pagi hari ini. Silakan, masih banyak kursi di bagian depan yang belum terisi. Mohon untuk kesediaannya bergeser ke depan. Terima kasih.
Bahwa organisasi yang baik sangat bergantung terhadap kehebatan orang-orangnya. Kita harus memiliki orang-orang yang bekerja di Kementerian Kesehatan jauh lebih hebat dibandingkan bukan hanya kementerian yang lain, tapi organisasi-organisasi lain yang ada di Indonesia. Itu sebabnya kenapa kita harus serius lagi membangun sumber daya manusia, dan itu merupakan pilar nomor 7 dari transformasi kita. Saya bilang, orang yang hebat itu punya budaya kerja dan budaya hidup yang berbeda dengan yang enggak. Yang saya ingin pesankan nomor 1, membangun manusia hebat itu sangat penting. Itu akan menentukan keberhasilan suatu organisasi. Yang nomor 2, manusia hebat itu kayak gimana? Itu yang punya budaya kerja yang hebat. Itu yang harus dibangun. Nomor 3, cara bangunnya gimana? Dilatih. Bukan diajari saja, harus dengan seorang mentor, bukan hanya seorang guru. Itu harus dilatih di tempat kerja, diberikan dalam bentuk contoh, dididik oleh seorang yang hebat budayanya, bukan orang yang hebat gelarnya. Saya ucapkan terima kasih ke teman-teman di Korpu ya, yang sudah membuat program yang menurut saya inovatif dan baru. Ibu dan Pak Bambang yang sudah membuat ini. Saya berharap benar-benar teman-teman nanti bisa mendapatkan ilmu dan contoh yang sebaik-baiknya dan bisa membangun budaya kerja yang hebat untuk menjadi insan-insan Kemenkes yang hebat dan bisa membawa Indonesia tidak kalah hebatnya dengan negara-negara lain.
Indonesia tengah mengalami periode bonus demografi yang terjadi hanya satu kali dalam peradaban sebuah negara.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. A very good morning to all of you, to all of us. Welcome to today's event on Global Expert Session 2. It's my great pleasure to welcome all of you. My name is Andre Rahman, and I'll be your host today. I'm thrilled to have you join us today. Today's event is collaboration between the Ministry of Health and the ASN Global, and it's part of the Global Expert Session and also aims to enhance the capacity of the hospital's champions. Before we proceed, I would like to extend a special welcome to our distinguished guests. First, Bapak Dr. Sunarto, Director of Health Service Governance, and then Dr. Maureen Lewis and team from the ASN Global, and then our speaker, Mr. Stephen G. Thompson, Senior Global Healthcare Consultant Principal, NorthStar Healthcare Advisor with expertise as pioneer and international business leader, as founder and CEO of Johns Hopkins Medicine International. And then, of course, Ibu Dwi Melani, Director of Center for Competency Development, Ministry of Health, and all of the participants from on-site and online. Selamat pagi hadirin yang ada di ruangan, apa kabar pada pagi hari ini? Luar biasa. Semangat pagi! Oke. Saya juga ingin menyapa para hadirin yang ada di ruang Zoom. Selamat pagi Bapak Ibu semua dan semoga berada dalam keadaan sehat walafiat. Di seminar ini kami mengundang jajaran Direktorat Jenderal Pelayanan Kesehatan dan para champion Rumah Sakit Vertikal. Boleh tepuk tangan untuk kita semua Bapak Ibu. Thank you for gracing us with your presence today. I'm truly honored to have you here. Bapak Ibu, sebagai informasi, Acara ini akan dibawakan dalam bahasa Inggris dan bahasa Indonesia. Dan kami juga menyediakan interpreter yang dapat diakses oleh Bapak Ibu di ruang Zoom. Seminar ini setara dengan 2 JPL, dan untuk klaim sertifikat dapat mengakses KMS Class pada multilink yang sama yang digunakan untuk mengikuti pembelajaran ini. Serta tentunya tidak lupa untuk mengisi post-test yang tersedia. Untuk sesi diskusi, peserta yang hadir secara daring dapat mengajukan pertanyaan pada kolom Q&A. Bapak Ibu hadirin yang kami muliakan, mengawali kegiatan kita pada pagi hari ini, mari kita berdoa terlebih dahulu agar kegiatan kita berjalan dengan lancar. Berdoa menurut agama dan kepercayaan masing-masing dimulai. Berdoa dicukupkan. Hadirin yang kami hormati, selanjutnya kita akan simak bersama opening talk dari Ibu Kepala Pusat Pengembangan Kompetensi ASN kepada Ibu Dwi Melani SKM MKM. Disilakan.
Terima kasih Mas Andre. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to all of us, Bapak dan Ibu, distinguished guests, colleagues, para ASN pembelajar semua. Saya juga ingin menyapa teman-teman yang ada di Zoom. Selamat pagi. Semangat pagi semuanya. Mudah-mudahan masih semangat. I'm honored to welcome you all to this seminar. And we are very privileged to have the presence of Bapak Direktur Sunarto. Pak, terima kasih sudah hadir bersama kita pagi ini. Kehadiran Bapak ini menunjukkan juga komitmen pimpinan Kementerian Kesehatan untuk meningkatkan kompetensi para ASN Kementerian Kesehatan. And a very warm welcome to our esteemed speaker, Mr. Stephen Thompson, the CEO of Jhon Hopkins International. Welcome to Jakarta. Welcome to the Ministry of Health. And it's an honor for us to have you here, long the way from USA. Thank you so very much. We do hope your expertise and leadership in the healthcare industry will undoubtedly enrich our discussion and inspire us all today. And of course, I would also like to extend our sincere gratitude to our partners at Assist Global, Ms. Maureen and team, Mariam, Pak Jack, Denise, your invaluable support in making this seminar possible. So we would like to thank you very much, Ms. Maureen and team. Bapak Ibu, kegiatan ini adalah bagian dari kegiatan Kemenkes Corporate University, di mana kita melakukan beberapa kegiatan pembelajaran. Bisa kami laporkan juga Pak Direktur bahwa untuk kegiatan saat ini kita beri judul Global Expert Session. Ini adalah sudah kegiatan yang kedua di dalam kegiatan Expert Session, dan kami khususnya pada saat ini mengundang teman-teman dari Sivitas Hospitalia dan juga jajaran pelayanan kesehatan sehubungan dengan tema yang relate pada kegiatan kali ini. Dan tentunya kami juga berterima kasih kepada Dr. Damar, moderator kita hari ini, dan Dr. Aryani, champion kebanggaan kita, yang bersedia hadir juga pada kegiatan hari ini. Dan tentunya Bapak Ibu semua, para ASN pembelajar yang sudah meluangkan waktu di antara kesibukan pekerjaan, para direktur rumah sakit juga sudah hadir di sini. Terima kasih atas komitmen kita semua untuk menjadikan Kementerian Kesehatan ini sekolah tempat kita sama-sama belajar. Selamat mengikuti kegiatan ini, dan selanjutnya kami mohon kepada Bapak Sunarto untuk bisa memberikan sambutan pada kegiatan ini. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Baik, terima kasih kepada Ibu atas sambutannya. Hadirin yang kami hormati, agenda berikutnya kita akan sama-sama mendengarkan sambutan sekaligus pembukaan oleh Bapak Direktur Jenderal Pelayanan Kesehatan Kementerian Kesehatan, yang dalam hal ini akan disampaikan oleh Bapak Direktur Tata Kelola Pelayanan Kesehatan. Kepada Bapak Dr. Sunarto MKes, disilakan.
Selamat pagi, good morning all. My distinguished speaker, Mr. Stephen Thompson. Thank you for coming to this seminar. I hope you enjoy your moment in Jakarta, in Indonesia, special. And I think this is not the last visit to Ministry of Health. So we hope you can come here again and sharing your expertise and sharing your experience about patient safety. Selamat pagi, Assalamualaikum warahmatullahi wabarakatuh. Yang saya hormati Bapak Ibu semua yang hadir sini. Salam dari Pak Dirjen yang hari ini harusnya hadir di sini karena beliau ada tugas peresmian rumah sakit di Yogyakarta di Sarjito. Jadi memang Dirjen Yankes dari pertengahan Agustus sampai dengan nanti pertengahan September Bapak Ibu, kita meresmikan rumah sakit hampir 8. Yang didanai oleh ASDB itu ada 6 atau 4 atau 6. Kemudian nanti ada rumah sakit baru di Makassar, di Surabaya, itu juga akan kita resmikan. Jadi rangkaian peresmian rumah sakit itulah yang mengharuskan beliau tidak hadir di sini. Salam dari beliau kepada Bapak Ibu semua, juga kepada para pembicara. Yang saya hormati staf ahli Menteri Kesehatan, kemudian Kepala Biro P2K ASN, Kepala Pusat ya, Bu Dwi Melani yang concern melakukan acara ini, juga teman-teman yang hadir dalam acara Leadership in Healthcare Quality, Driving Excellence and Patient Safety. Bapak Ibu, kita sering diingatkan oleh Pak Menteri. Pak Menteri itu selalu punya cara untuk mengingat sesuatu. Jadi pernah beliau menyampaikan ke kita, kalau belajar itu tidak perlu banyak-banyak, tapi yang penting diingat. Dan kalau sudah diingat, diimplementasikan. Nah, kalau kita bicara keselamatan pasien, apa yang kita ingat pertama, Bapak Ibu? Tentang apa? Pasti tentang sasaran keselamatan pasien. Itu yang harus kita ingat. Kalau we talk about patient safety, gitu ya. Apa yang pertama kali ada di pikiran kita itu tentang sasaran keselamatan pasien. Mungkin kita harus mereview lagi tentang sasaran-sasaran keselamatan pasien yang wajib kita ingat. Ada berapa Bapak Ibu? Ada berapa? Ada 6. Bagus ini Ibu Dwi, pesertanya udah belajar duluan. Jadi nanti dikasih hadiah Bu Dwi. Ada 6 sasaran keselamatan pasien yang sebenarnya sehari-hari kita lakukan. Cuman kadang-kadang kita tidak ingat ini benar nggak ini menjadi fokus untuk sasaran keselamatan pasien. Pertama, identifikasi pasien. Kita harus mengidentify who the patient, siapa pasiennya yang kita tangani, namanya benar gitu ya. Nanti dokter Aryani, jangan bilang Aryani pakai Y, Aryani pakai I gitu. Jadi berarti ada cara menentukan identifikasi pasien dengan cara NIK kek, NIP kek, apa kek lah segala macam gitu ya. Itu yang pertama. Kemudian yang kedua, komunikasi yang efektif. Komunikasi efektif itu tidak berarti bahwa komunikasi yang singkat-singkat, bukan. Komunikasi yang dilakukan seperlunya untuk menunjang pelayanan pasien. Ya, misalnya kalau Bapak Ibu berkomunikasi dengan dokter saat pelayanan pasien. Apa sih yang harus dibahas? Itu ya disebut komunikasi efektif. Kalau periksa lab, emergency, angkanya itu ada ditentukan. Sehingga tidak semua harus dilihat, tapi ada angka-angka yang emergency. Itu namanya komunikasi efektif. Yang ketiga apa? Kewaspadaan pada obat-obat yang high alert. Jadi kalau Bapak Ibu pelayanan nanti di rumah sakit, walaupun yang hadir ini para champion-champion dan para manajemen di rumah sakit, high alert ini harus kita pahami tentang obat-obatan. Mana obat-obatan yang harus dijauhi dari layanan petugas ya, mana-mana yang harus dilabel itu diingat. Kemudian yang ketiga, yang keempat apa? Penandaan sisi operasi. Bapak Ibu sudah banyak melihat kesalahan-kesalahan kita ya, kiri yang sakit, kanan yang dipotong, ya kan? Kiri yang bermasalah, yang kanan yang diradiasi atau dilakukan pencitraan radiologi dan sebagainya. Ya, itu yang keempat. Yang kelima apa? Tentang infeksi. Ya, Bapak Ibu tahu bahwa sekarang kita juga di Indonesia lagi persoalannya dulu antimicrobial resistant. Itu membutuhkan biaya yang cukup besar. Jadi teman-teman semua tentang infeksi ini tolong dijaga dengan baik. Di rumah sakit sudah ada komite PPI ya, pencegahan dan penanggulangan infeksi, dan ini menjadi fokus kita semua. Kemudian last but not the least ya, itu adalah tentang pencegahan resiko jatuh. 6 inilah yang Bapak Ibu ingat ya. Nanti ditambah speaker kita ya, Mr. Thompson. Jadi mudah-mudahan wawasan Bapak Ibu tentang keselamatan pasien ini bertambah. Kita tahu bahwa pengetahuan dunia kedokteran bertambah terus ya. Belajar itu menjadi sesuatu yang wajib kita lakukan. Kementerian Kesehatan melalui P2K ASN sekarang sudah menyediakan begitu banyak waktu, tempat, kanal yang bisa kita ikuti. Kemudian setiap kali mengikuti kegiatan-kegiatan seperti ini, kita dapat SKP ya melalui LMS. Jadi kita bertepuk tangan untuk P2KSN, kita berikan tepuk tangan Bapak Ibu. Juga teman-teman yang lain, Aseso team, thank you for your collaboration with us. And we hope your collaboration make a long time in Indonesia. Saya kira itu Bapak Ibu yang bisa saya sampaikan. Sekali lagi terima kasih kehadiran Bapak Ibu semua yang hari ini sudah bersedia hadir, bersedia menyediakan waktunya, karena ini menjadi penting bahwa Bapak Ibu harus berkembang. Ya, Bapak Ibu harus belajar, teman-teman harus belajar. Sehingga apa yang teman-teman berikan nanti kepada pasien di rumah sakit, di fasiankes, dimanapun Bapak Ibu bekerja, apakah menjadi direktur, apakah menjadi manajemen, atau menjadi pelayanan, itu adalah ilmu-ilmu yang terupdate. Ilmu-ilmu yang paling update yang bisa Bapak Ibu berikan. Sehingga layanan kita menjadi layanan yang berkualitas. Selalu ingat kita bahwa keselamatan pasien itu selalu dekat dengan mutu. Makanya kita sebut mutu dan keselamatan pasien. Kalau layanannya bermutu, pasti memberikan keselamatan pasien. Oleh karena itu, himbauan terakhir dari Pak Dirjen, berikanlah layanan yang bermutu, layanan yang sepenuh hati, jangan ada bully-bully lagi, ya, bullying, jangan ada lagi, dan itu membuat kita semakin percaya bahwa kita adalah insan kesehatan yang bermartabat. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Baik, terima kasih kepada Bapak Direktur yang telah memberikan sambutan sekaligus membuka kegiatan kita pada pagi hari ini. Well, ladies and gentlemen, I'd like to inform you that right now have joined with us in Zoom webinar. It's about 1,000 participants. And also have joined with us in streaming YouTube. It's about 500 participants. Oke, tepuk tangan untuk kita semua. Luar biasa memang. Antusiasme ya untuk mengikuti Global Expert Session 2 yang kita adakan pada pagi hari ini. Okay, dear participants, and now let's move to the main event of today's agenda. But before we do, we'd like to invite you all to meet our moderator to lead this presentation and discussion. Advisor to the Minister of Health of the Republic of Indonesia, Dr. Damar Susilaradaya, Master of Research, PhD. Well, Dr. Damar, time is yours. Ladies and gentlemen, please give a big applause.
Good morning, everyone. I hope everyone is in good health and as excited as I am for this panel. It is my pleasure to welcome you all to this important global expert session on leadership in healthcare quality, driving excellence and patient safety. I am Damar Susilaradaya from the Center of Health System and Strategy at the Ministry of Health, and it is my honor to be your moderator for this session. Today's discussion is especially relevant to all of us here at the Ministry of Health. As we work to enhance the quality of healthcare, and ensure patient safety across Indonesia, each one of us plays a critical role in leadership. Whether you are leading teams, implementing policies, or delivering care directly to patients, your actions and decisions contribute to the larger mission of improving our healthcare system. I'd like to take a moment for us all to reflect. Have you thought about your role in leadership? How do you influence healthcare quality and patient safety in your daily work? As we go through today's session, I encourage everyone to consider these questions and think about how the insights we gain can be applied in your own context. We are fortunate to have with us today some of the foremost leaders in global healthcare who will share their experiences and strategies. Their insights will help us all to think more deeply about the impact of our roles and how we can each contribute to driving excellence in healthcare. Let's begin by introducing our first speaker, Mr. Stephen J. Thompson. Mr. Thompson is a distinguished leader in the global healthcare industry with over 2 decades of experience driving innovation and excellence across international healthcare systems. Known for his visionary approach, Stephen has successfully led numerous transformative initiatives aimed at improving healthcare delivery, enhancing patient outcomes, and fostering sustainable growth in both public and private healthcare sectors worldwide. Throughout his career, Stephen has held pivotal roles in renowned healthcare organizations, including Johns Hopkins Medicine International, where he served as CEO, and Brigham and Women's Hospital, where he played a key role in expanding their global footprint by establishing healthcare partners in regions such as the Middle East and Asia. He also collaborated with a range of NGOs on strategic healthcare initiatives in developing countries, focusing on capacity building and strengthening health systems. Today, Mr. Thompson will share his insights on how leadership can be a driving force for quality improvement and patient safety in healthcare. Please join me in welcoming Mr. Stephen J. Thompson.
Good morning, everyone. I'm honored to be here with you today. And I want to thank all of the introductory comments. It was very heartening to hear Dr. Sunarto's review of the safety goals that you have, and also the comments about how safety is the responsibility of every one of us. In our pursuit of healthcare quality, each of us is a leader. Each of us is invaluable to achieve the objectives that we have. Do we have the slides? My slides, maybe? If not, I wanted to start out by saying, in today's rapidly evolving healthcare landscape, the pursuit of quality is not just a goal, it's a mandate. The stakes are high. Our patients' lives and well-beings depend on it. Next slide. Leadership is the cornerstone of achieving excellence in healthcare quality, ensuring that every patient receives the safest, most effective care possible. Today, we will explore how effective leadership can drive quality in healthcare, overcoming the challenges that we face and making a meaningful impact on patient outcomes. So today, I wanted to spend some time to actually define healthcare quality. Each of us has a slightly different view on it, but I'll put forward my definition for your consideration. And also to highlight the role of leadership in pursuit of healthcare patient safety goals. Again, remembering all of us are leaders in this context. To talk about some of the core principles of leadership as they apply to safety, identify some of the key leadership skills that each of us needs to be effective members of teams pursuing safety and healthcare excellence, and then to talk about some of the common challenges that we have. Next slide. Let's begin by defining what we mean by healthcare quality. Healthcare quality refers to the degree to which healthcare services increase the likelihood of desired healthcare outcomes consistent with current knowledge and the science behind safety. In simpler terms, it's about ensuring that every patient receives the best possible care that is safe, effective, and centered around their specific needs. Now, why is healthcare leadership so crucial in this context? Because leaders set the tone and direction for quality improvement methods, ensuring that every member of the organization is aligned with the goal of delivering exceptional care. When I talk to audiences about it, I start out in a kind of a lighthearted way by saying, all of the easy problems in patient safety have been solved. All of the easy ones are done. All that remains are the difficult, complex problems that require each of us to work together to solve. So that's why we're here today, to see and understand how we work together to achieve these goals. And they are achievable. Without strong leadership, quality initiatives can falter, leading to less than desired patient outcomes and organizational inefficiencies. As leaders, it is our responsibility to ensure that quality is not just a priority, but the foundation of everything we do every day. Next slide. Next, let's review the core principles of leadership. To lead effectively in healthcare quality, there are 4 core principles that we must embrace: patient-centered care, evidence-based practice, continuous improvement, and collaboration and communication. Some of these terms you would have heard before in different contexts, and I'll just review a little bit more deeply what they mean in this context. First, patient-centered care. At the heart of quality healthcare is the patient and their family. As leaders, we must ensure that care is tailored to meet individual patient needs, preferences, and values. This means actively engaging patients and their families as partners in the care process. When patients feel heard and involved in their care, outcomes improve and satisfaction increases. The second element is evidence-based practice. Quality care is grounded in the best available evidence. As leaders, we must promote a culture where clinical decisions are informed by up-to-date research and data. This includes investing in continuous education and training for all of our staff to ensure they have the knowledge and skills to provide evidence-based care. Third, continuous improvement. Healthcare is not static, as you know. It is a dynamic field that requires constant evaluation and enhancement of our practices. As leaders, we must all foster an environment where continuous improvement is the norm, not the exception. This involves using a variety of tools to drive iterative improvements in healthcare. We have a little bit of advancement, we try again, we keep improving. The final element is collaboration and communication. Quality improvement is a team effort. Effective leaders involve building strong interdisciplinary teams that work together towards shared goals. This is a theme that we'll keep coming back to this morning. Transparent communication is key. Leaders must ensure that everyone has the same understanding and is, as we say, on the same page regarding quality initiatives and goals. When communication breaks down, so does the quality of care. Next slide. Now let's review some of the key leadership skills for enhancing healthcare quality. To drive healthcare quality, leaders, and in this case all of us, need a specific set of skills. Let's delve into some of the key skills that are crucial for enhancing healthcare quality. The first, visionary thinking, is essential. Leaders must articulate a clear vision for quality improvement that inspires and motivates the entire organization. Again, this is a long-term commitment that we have to quality, and leaders must show the way and keep everyone engaged. The vision that's created should align with broader organizational goals and the needs of the patients we serve. When leaders set a clear direction, it becomes easier for the team to focus on achieving the desired outcomes. Another critical skill is emotional intelligence. Leaders with high emotional intelligence are better equipped to manage team dynamics, resolve conflicts that will inevitably arise, and maintain morale and commitment, all of which are critical for sustaining the ongoing quest for quality improvement. Understanding and empathizing with the challenges that staff face can lead to more effective leadership and a more engaged workforce. The third, effective decision-making, is also vital. In healthcare, the ability to make timely, well-informed decisions can directly impact patient safety and outcomes. Leaders must make informed decisions based on data, evidence, and input from frontline staff. And I want to emphasize that point. Frontline staff are the closest to both the problem and the solution. And so it's very important that leaders consider frontline inputs into all of our moves. This collaborative approach ensures that decisions are not only sound, but they're also practical, feasible, and can be implemented. In a constant changing environment, adaptability is a must. The healthcare environment is constantly changing. Leaders must be flexible and responsive to new challenges and opportunities. Adaptability is especially important in times of crisis, such as during a pandemic, which we've all recently lived through, or major policy change, which you're also living through, when the ability to pivot quickly can make all the difference in maintaining quality care. Finally, leaders must focus on empowerment and mentorship. Developing others and fostering leadership within teams is crucial for creating a sustainable culture of quality. Leaders should empower their teams by delegating authority and providing the resources and support needed to succeed. Additionally, mentoring the next generation of leaders ensures that quality improvement remains a priority for the years to come. Next slide. While the principles and skills we've discussed are essential, leading for healthcare quality is not without its challenges, as we all know. Let's explore some of the common challenges leaders face in this area and how we can address them. The biggest I would put to you is managing resistance. Managing resistance to change is a significant challenge. Change is often met with resistance, especially in healthcare. Leaders must be skilled in change management, using strategies to engage and motivate staff to embrace new practices. Communicating the why behind changes can help reduce resistance and increase buy-in. When staff understand the purpose and benefits of a change, they are more likely to support it. Another challenge is navigating resource constraints. One of the hallmarks of healthcare worldwide is that there are never enough resources. Leaders often face this challenge of maintaining high-quality care with limited resources. This requires creativity, prioritization, and efficiency. It's essential to advocate for necessary resources while also finding innovative ways to do more with less. This might involve leveraging technology, streamlining processes, or reallocating resources to areas of greatest need. Second, balancing quality and cost is an ongoing tension in healthcare. Quality care doesn't always mean higher costs, but leaders must navigate the tension between maintaining high standards and controlling expenses. Investing in quality can lead to long-term cost savings through reduced complications and improved patient outcomes. It's about finding the right balance where quality care is delivered in a cost-effective manner. Addressing burnout. As you know, healthcare jobs have tremendous pressures on them. Addressing burnout among healthcare workers is another significant challenge that can undermine quality. Leaders must recognize the signs of burnout and take proactive steps to support staff well-being. This includes promoting work-life balance, providing mental health resources, and fostering a supportive work environment. When staff are well supported, they are better able to deliver high quality care. And I recognize that this is an area that probably gets the least attention, but is something that I think we do need to consider. Next slide. I wanted to go into a couple examples that will show some of how effective leadership has driven quality improvement in healthcare. The first example, a hypothetical example, but something that has real life elements to it, certainly. A hospital was struggling with high infection rates. I know that's one of your priorities, which were negatively impacting patient outcomes. The leadership team recognized this as a critical issue and launched a comprehensive initiative to standardize hygiene practices across all departments. They implemented strict protocols, provided training, and continuously monitored compliance. As a result, the hospital reduced its infection rates by 50% within a year. This success was driven by leadership's commitment to quality and their ability to motivate the entire organization around this goal. The second example I'll go into is a healthcare system faced declining patient satisfaction scores. The leadership team decided to tackle the issue by implementing a communication training program for all staff, led by the leadership team. The program focused on improving patient interactions, ensuring that staff were not only delivering care, but also communicating effectively with patients. Over the course of a year, patient satisfaction scores improved by 20%, demonstrating the impact of leadership-led initiatives on quality and patient care and effectiveness. So let's go into case one a little more deeply. Next slide. A little more background on the reducing hospital-acquired infection example. A large urban hospital was experiencing a high incidence of hospital-acquired infections, which were leading to extended patient stays, increased healthcare costs, and in some cases, poor patient outcomes. The hospital's infection rates were significantly higher than national benchmarks, promoting concerns among staff, patients, and the hospital leadership. The leadership team recognized that urgent action was needed to address the issue. What did leadership do in this example? The hospital's executive leadership team, including the chief medical officer and the director of nursing, took ownership of this problem. They understood that hospital-acquired infections would require a comprehensive and coordinated effort across all departments. What did they do? They formulated a multidisciplinary task force comprised of representatives from all across the organization that had a stake in this, from infection control, nursing, housekeeping, the medical staff. Everyone got together. This task force was charged with analyzing both the root causes of the infection rates and developing an action plan to address them. This multidisciplinary group certainly looked at this problem from very different ways, but together the benefit was clear. Second, the development of standardized hygiene protocols. Based on evidence-based practice and guidelines from government agencies, the task force developed a set of standardized hygiene protocols. These included strict hand hygiene, use of personal protective equipment, and protocols for cleaning and disinfecting patient rooms and medical equipment. The leadership team also recognized that success would depend on the consistent application of these protocols across the hospital. To ensure this, they implemented a comprehensive training program for all staff, from doctors, nurses, housekeeping, support staff, everyone who worked in the hospital. Training sessions were mandatory, included both practical demonstrations, workshops, and ongoing training. The fourth element was a compliance monitoring element. To reinforce the importance of the new protocols, the hospital introduced a compliance monitoring system. Leadership encouraged a culture of accountability by implementing routine audits of hand hygiene practices and environmental cleanliness. Non-compliance was addressed immediately with additional training or corrective actions. Engagement and communication were key. The leadership team maintained open lines of communication with the staff throughout the process. Regular meetings were held to discuss progress, share success, and address concerns and challenges. This helped to build a sense of collective responsibility and commitment to the quality improvement initiative. In this hypothetical example, the group was able to, within 12 months of implementing the new protocols, the hospital saw a 50% reduction in hospital-acquired infection rates. This improvement not only enhanced patient safety, but also led to significant cost savings due to reduced patient stays and fewer complications. The success of the initiative was widely recognized within the organization and served as a model for other quality improvement projects. The hospital leadership's proactive approach, focusing on evidence-based practices and commitment to staff engagement were key factors in these outcomes. And clearly, these are transferable elements to many of the problems we face in continuous improvement and quality. Next slide. The second example is the improving patient satisfaction. In this scenario, a regional healthcare system comprised of multiple hospitals and outpatient clinics was experiencing declining patient satisfaction scores. Patient feedback highlighted concerns about communication issues from the staff, insufficient information given to patients about the treatment they were receiving, lack of empathy from the healthcare providers, and inconsistent communication across different care settings. Does any of this sound familiar? We all experience it every day. These issues were affecting the system's reputation and could potentially impact reimbursement rates tied to patient satisfaction and the willingness of people to use this facility. So how did the leadership respond? Next slide, I think. Yes. Recognizing the critical role of communication in patient care, the system's executive leadership team decided to address this issue head on. They understood that improving communication would require a cultural shift and a significant investment in staff development. The leadership team began by conducting a thorough assessment of the current communication practices. They reviewed patient feedback, conducted focus groups with staff, and observed interactions between healthcare providers and patients. This assessment helped identify specific areas where communication was breaking down. Second, to make improvements in this area, they developed a communication training program. Based on the assessment, the leadership team collaborated with experts in healthcare communication to develop a comprehensive training program. The program focused on several key areas: active listening, training staff to listen attentively to patients and their families' concerns and questions; clear and compassionate communication, ensuring that healthcare providers explain treatment plans and procedures in a way that was easy for patients and their families to understand; and third, consistency information, training staff across all settings to provide consistent information to patients regardless of where they were receiving care. The third element of this program was leadership-led training sessions. And this is important. To demonstrate their leadership and to demonstrate their commitment, the leadership team personally led many of the initial training sessions. This included the leaders of the organization acting in workshops and role-playing exercises with frontline staff. Their involvement underscored the importance of the initiative and helped to foster a sense of ownership among the staff. And then finally, integration of these improvements into daily practice. The training program was not a one-time event. Leadership ensured that communication skills became a core part of the daily practice through regular coaching, providing feedback, and ongoing professional development of staff. They also implemented a system for recognizing and rewarding staff who excelled in patient communication. Leadership also took the innovative step of involving patients in the training process. Patient advocates were invited to share their experiences and perspectives, helping staff to understand the real-world impact of effective communication. This patient-centered approach further reinforced the importance of the initiative. Over the course of a year, the healthcare system saw a significant improvement in patient satisfaction scores with a 20% increase across the board. Patients reported feeling more informed, respected, and cared for, leading to overall satisfaction. The improved communication practices also contributed to better clinical outcomes, as patients were more likely to follow the treatment plans when they clearly understood their care. The leadership's active involvement in the training process showed a commitment to staff development, and the focus on patient-centered care was critical to the success of the initiative. The network's enhanced reputation for patient communication also led to an increase in patient referrals and overall growth of the hospital's population. From these examples, we can see that leadership commitment, clear vision, and strategic action are key to driving significant improvements in healthcare quality. Leaders must be proactive, patient-focused, and continuously seek to learn and adapt. These cases show that with the right leadership, even significant challenges can be overcome, leading to better outcomes for patients and the organization. Next slide. Is that it? As we conclude, let's recap the key points we've discussed today. Leadership in healthcare quality is about setting a vision, fostering a culture of continuous improvement, and ensuring that patient care is at the forefront of all decisions. Strong leadership is essential for overcoming the challenges and complexities of today's healthcare environment. Now I urge all of us to reflect on our own leadership practices and consider how we can better drive quality improvement in our organizations. What steps can we take today to empower our teams, enhance communication, and improve patient care? Whether it's mentoring a colleague, implementing a new evidence-based practice, or simply taking the time to listen to your staff, every action counts. Remember, the pursuit of healthcare quality is an ongoing journey. As leaders, all of us are leaders in this. It is our responsibility to lead by example and to inspire those around us to strive for excellence in everything we do. Together, we can create a healthcare system where quality and safety are the cornerstone of every patient interaction, and we can realize our patient safety goals. Thank you.
Thank you, Mr. Thompson, for those valuable insights. Your experience and strategies provide us with a strong foundation for understanding the critical role of leadership in healthcare quality and patient safety. Next, I'm pleased to introduce our second speaker and panelist, Dr. Aryani Dewi Widodo. Dr. Aryani is a highly respected figure in the field of pediatric gastrohepatology and healthcare quality improvement. She is currently the head of the Pediatric Gastrohepatology Unit at Harapan Kita Mother and Child Hospital. Her extensive background includes leading roles in quality and accreditation at Harapan Kita Mother and Child Hospital, where she has been instrumental in driving significant improvements in hospital practices. Dr. Aryani is not only a healthcare leader, but also an academic, currently pursuing a master's degree in clinical service operations from Harvard Medical School. She's also a fellow of the International Society for Quality in Healthcare and a WHO scholar. Today, Dr. Aryani will share a few words on her insights on how leadership in healthcare quality can be a transformative force within hospital settings. Please join me in welcoming Dr. Aryani Dewi Widodo.
Thank you. Thank you for the kind introduction, Dr. Damar. It's, I think, way overestimating, but okay. Now, ladies and gentlemen, colleagues, Mr. Stephen Thompson, thank you for the opportunity to comment a little bit on the leadership in quality improvement. This is a very close topic to my heart because I really truly think that this is very important, and this determines how the healthcare system will go. And I couldn't emphasize enough what Mr. Stephen Thompson have presented very clearly about those aspects in leadership. And healthcare leadership is actually not the same at all as other leaderships. It is different, and it needs deep understanding and balance between business and humanity. So if other businesses focuses on revenue, on business, in healthcare, we don't do that. Why? Because the main goal is not the revenue. The main goal is to, ideally, the main goal is to serve. And the leaders have to manage the patients as customers and the staff. That's what happens in other businesses. But here, it's the patient, the staff, the insurance, the equipments, and the overall services. And so the legend had said that doctors are the most difficult species. Is that true? I am sure it's not true anymore at these days, I hope. And the leader should set the tone for quality. And they have to create an empowering environment and not a fear-driven environment. Because then if they create an empowering environment, then the staff will be engaged and given access to pertinent opportunities, information, support, and resources. And they have to make a non-blaming environment in order to grow and to learn from mistakes. That also means giving some space for learning by themselves. And they have to make all the staff leaders, because all the staff should be able to be a leader to themselves first. And then they will be able to gather with their colleagues as a team leaders. And the team leadership has to have a common vision. And so what is important here is that the staff should not be thinking that they are leaders and I am the staff and I'm not the leader. But actually, they have to realize that each of them are leaders by themselves. And leadership is different for each individual. So the leader should make it real. How? They have to see each person's skill set. They have to develop each person's skill set so that we can help them to help themselves. And these cycle of learning and improving and learning and improving should go on, and the leader should get the improvement cycle flow. Lastly, what Mr. Stephen Thompson also already mentioned, the leaders must be role models, because the senior leader's behavior will then be amplified throughout the hospital, throughout the organization that they lead, whether they recognize it or not, whether they realize it or not. And the staff will judge what is important by where and how the leaders spend their time, rather by what they say. And so the important task of the leader is how they can give good examples. And as Mr. Thompson has said, they have to make new leaders, because in all organization, including in the government, including in royalties, the role of a leader is to create other leaders. And this is what is often forgotten. Because when you are leaders, you forget that you have to create a successor. And also there are fears that the successor will get you out of your place, out of your position. But that's not what good leaders do. I know very good organizations in Indonesia where they really optimize mentorship, and where the little leaders are proud if the students or the mentee that they are responsible for are growing even more than themselves. So let's create that kind of environment. And with this kind of leadership, then we will make a better and better health system for all of us. Thank you.
Thank you, Dr. Aryani, for the insightful and inspiring sharing. So next we will move to question and answers. Can I ask the first question? Yeah. Yeah, I was really inspired by your talk, and I noticed that you mentioned frontline workers, and you said that they are really important and the closest to the problem, but also the solution. Could you perhaps explain a bit more? Like, I'm not sure that I or other people understand who are these frontline workers.
Well, good. Thank you for the question. I think that in the context that I was using, frontline workers are really all of the people who directly impact or directly interact with patients and their families. So that's the nursing unit staff, including the people that are cleaning the room, that are delivering the meals, that are transporting the patient to tests and everything, because they are again closest to the action, as we say. So they are able to understand on a very real basis the challenges that exist. And oftentimes they're overlooked in providing solutions. Because I think many people in those roles, if you ask them, they have a lot of great ideas about how to make improvements, but they don't feel, to your comment, empowered. They feel, I should just do what I'm told. I just keep doing it, even though I know there's a better way. And I realize also that the idea of empowerment can sometimes be frightening to people, because with it comes some responsibility as well. But once we say, and I liked your example of leaders being role models, because leaders can help say, yes, we understand it's scary, but you're the best expert at understanding the problem and helping us find the solution. So it all fits together like a puzzle.
Thank you, Rusty. Would you like to add anything, Dr. Aryani?
Well, I totally agree with Mr. Thompson. And these people are actually the ones that can get into the heart of the problem. I remember in our hospital, we were trying to implement Kaizen approach. So all over the hospital, each unit are required to have a 2 quality improvement every 6 months or so. And so the quality improvement project should be little. So it doesn't have to be big, and it's not suggested to be big, just little improvement that you can do every day in your workplace. For example, if they are difficult to find patients' physical records, we used physical records back then. It's all over because so many people are using it, the nutritionists, the therapists, the nurses, the doctors, the students, medical students, and the residents. It's all over the place. So they are making this kind of a system where they make a rack, just not making or building a rack, just putting an assigned table where the files should be placed, and they put numbers on it, so you know which one is missing instead of just looking or searching all over. And I mean, that kind of very, very simple solution makes their lives better. And they measure like how much time do they need to look for a file before and after the implementation of that innovation. I think that kind of thing is the solution that we need from all of the frontliners.
Thank you so much, Dr. Aryani. I think it's very interesting and actually not that complicated problem to solve. Yeah. Okay.
It's all complicated.
Yeah, okay. Well, now I'd like to encourage everyone here in this room and also on Zoom. I already see someone raising their hands. So yeah, if you could, yeah, please give the microphone and please introduce yourself before asking your question. Thank you.
Thank you. Thank you for the opportunity and your insight and wisdom. My name is Adi. I'm a physician, a surgeon at the National Brain Center Hospital in Jakarta. I have two questions. The first maybe to Mr. Thompson. You know, with the rising technological advances, it puts constraints on the health system also with the increasing cost. And a surgeon wants the best toys, the newest technology. It drives cost. And how, maybe my question is, how do you raise awareness about cost to the surgeons, the doctors, who are the gatekeepers of the cost, and also maintaining high quality services? And second, to Dr. Ari, a good friend of mine, maybe you have some advice to mid-level managers, because I think mid-level managers are in a unique position of seeing the issue firsthand, and maybe also insights to solution. The trick is how to manage your boss, maybe to see things from your perspective also. Thank you.
I'll start. So the question relates to, I'll just repeat it to make sure I understand it. In a resource-constrained environment and the continuous improvement and availability of new equipments and technology, particularly in the surgical area, how best are decisions made in that area? And I would say, I mean, this is a dilemma that all hospitals have. And I like the example where, in this case, in this specific case, actually a group is put together that includes surgeons to help evaluate the requests, because it takes away, it changes the dynamic of give me this because I want it, to something that's more interactive, where colleagues can ask questions about the efficacy, the importance, how it can fit into all of the priorities of the organization, including improving patient outcome, potentially reducing length of stay or complications, other things than that. I think that including physicians in this kind of decision-making process in a very open way actually creates a better outcome, and it also reduces the negative feelings that come with the inevitable. Sometimes the answer will be no. But again, at the front end, as leaders, all of us want to change the dynamic so that it's not just give it to me because I want it. Let's see how we can work effectively towards an answer and get the equipments that are needed. Thank you.
All right. Thank you, Dr. Adi. As he said, his name is Adi. My name is Aryani. So we are both A's. And in medical school, they put us based on the alphabet. So we are together from first grade to sixth grade. Thank you. So for the middle level managers, actually, these middle level managers is the most important people, because they are the hub between the senior managers and the team or the staff. These middle level managers are the people who has to have the role of leadership, strong leadership, but however, they still have to follow the regulations and the change of tone that the senior leaderships send. And oftentimes, they also have to buffer the unpleasant regulation change to their staff, while still maybe they're upset themselves, but they still have to set the tone, the milder tone for the staff, and trying to find a good solution to get it through with taking all the team with them. So I think in this middle-level managers, is the actual test of how or whether they could be going up as a senior leaderships. I hope it answers the discussion.
Thank you, Dr. Aryani. Thank you, Mr. Thompson. Anyone else would like to ask any questions? Please raise your hand. Yeah. Please introduce yourself first.
Yes. Good morning. My name is Putri and I'm from Persahabatan General Hospital. I have 3 questions, 2 for Mr. Thompson and 1 for Mbak Aryani. So my question to Mr. Thompson is, how do you train emotional intelligence? I know some leaders are very brilliant, but I think they lack emotional intelligence. So can you train that? Or are they just not fit to be leaders? And then the second question is, what is your opinion on measuring patient experience? As opposed to patient satisfaction. I don't know if that is like a Indonesian culture, but people will give high scores on surveys. So they have very high satisfaction, but we get like bad reviews on Google review or such. So there might be a gap between patient satisfaction and patient experience. And for Mbak Aryani, as a junior leader, how do you get people to listen to you, especially the senior ones who are resistant to change? Thank you.
Thank you very much, Dr. Piti, for your question. Dr. Aryani, would you like to go first this time? Or Mr. Thompson?
Yeah. So I'm not sure I heard the end of your explanation or your question about emotional intelligence, but I would say that in some ways, emotional intelligence just basically is the way that I would describe it is the awareness of our goals and aspirations and feelings in the context of everybody else, so that it's about being aware that other people might not agree with us or have the same perspective or even approach a problem the same way or see it the same way, but being open to understanding the other perspective, to ask questions, to be engaged with people rather than just imposing your own views on somebody else. So that's how I would. Hopefully that answers your question a bit.
How do you train?
So I am not a social scientist in this regard at all, and if I knew that, I probably would be in a different line of business. I would probably be, if I was trained in that, I would be able to answer your question. But I think that actually the way that, as a leader, the way that I approach it is I choose to, during the employment process, choose to look for people that demonstrate and to test for emotional intelligence as you're choosing people in your organization to work in various groups and to assume leadership roles. I think that sometimes emotional intelligence is not something that we look for or that we view as a positive attribute when choosing leaders or promoting people. So I think that's the way I do it. First, introducing people with those kind of characteristics into the organization and then rewarding them and look for that skill as you are developing leaders in the organization.
Oh, maybe if I can share something, because Mr. Thompson is the senior leadership, very senior leadership, and I might be the lower, the lower staff. And what we do in our hospital is that we try our best to engage the team. People are born with different basics, and they come from different backgrounds. So how they speak, how they respond to other people could be different. For example, in Indonesia, we have Sumatra people, Medan, which when they speak, we thought they're angry, but they're not. because they talk loudly. And in Japanese, we thought they're afraid because they speak very slowly. Yes, and they're very kind. But maybe you don't know when they're angry at you. And so what we do is we try as much as possible to engage the people and work together and try to put them into different teams each time so that they know each other. When you know someone well, then you will develop more understanding between each other. And when the understanding is developed, then you will work better with each other. That also happens with patients, actually. So when they feel better, they will perform better to the patients. Maybe that's one or two things that can be tried or implemented in your place. I don't know if it's applicable.
I think this discussion and your questions actually have tied together very nicely what you've described, because I recognize sometimes the assessment of patient satisfaction actually is not effective, particularly filling out surveys or answering survey questions, because as you say, people will always give 5 stars. But I would submit that, as you said, that if we take cues from people, both verbal, nonverbal cues, emotional intelligence, of really understanding what a patient is going through, how their family is interacting with the staff, those things give much better cues or insight into how satisfied a patient is, rather than asking them to give you a star recognition or answering 5 questions on a paper survey. So I think that awareness of these, particularly nonverbal, sometimes verbal, could be very clear as well, are much better effective ways to assess patient satisfaction.
Thank you. And probably for the next question about junior leaders, the most junior leaders are individuals, obviously, so they have to lead themselves. But above that, I think what you mean is some kind of a team leader. For example, in a shift, in every shift, like nurses in the ICU, they work like 4 people in one shift, and one of them would be team leaders. Now, that is the junior leader. And the junior leaders need to be empowered, actually. We often miss that. We just think that, well, yeah, you are all juniors and your leader is the head of the ICU. But no, each of the junior leaders are leaders. And in order for them to get their work done well, while maintaining the well-being of their staffs, is by empowering them leadership. And empowering them leadership means they need to know how to manage their staff, how to recognize each staff's skill set. For example, one person is a bit clumsy, so they have to be combined with the other person who is very meticulous and precise. And so they can take care of each other. But maybe this person is a bit not well. This meticulous person could not stand for a long time. That kind of detail, and then the other staff can cover for them when they are tired or when they need to eat or drink first. That kind of detail needs to be observed by the junior leaders so that they can bring their team, even only in a shift, to success for finishing their shift very well. And if all the junior leaders are leading their staff, finishing their shift very well, then you have a 24-hour of perfect shifts. So that's the importance of recognizing the junior leaders.
Thank you. Must be really nice with a perfect shift. We're gonna take another question here from the floor. Does anyone like to ask the questions? You can raise your hand. If not, we'll take the opportunity to see the questions from the audience online. Maybe can we put it on the screen? Or anyone here still want to ask any questions? You can also raise your hand. Oh, okay. You got the questions here. Yeah, okay. Okay, first question from Dwi Hartanto. What strategies can be implemented by healthcare leaders in Indonesia to balance the demands of quality improvement and patient safety while also navigating the unique challenges posed by the local healthcare system? Would you like to start, Dr. Aryani?
Okay, the answer is it's hard. It's hard. Yes, and this is the main challenge that healthcare leaderships have to face. Again, as we both already mentioned in the beginning, we have to do quality improvement, but we should not. We should make revenues as expected by our organization. But on the other hand, we really need to consider the quality improvement and patient safety. For example, in one hospital that I went to as a surveyor, they decided that they could only provide one gloves for a shift for a person in order to reduce cost. Now, that's really, I'm sorry, but that's a stupid idea, because you think you reduce cost in this side, but you will end up having a lot of nosocomial infection, which costs you much, much more than that kind of cost. So that's why the leaders have to be wise. And wise is not an easy word, because your decision is made on day-to-day basis, on case-to-case basis, and there isn't any book to guide you on which one is a wise decision and which ones aren't. But you really have to engage your team and discuss together, and that is actually the role of risk management, where you consider in the beginning what would happen and what are the potential losses and benefits that you will get with that decision. Maybe Mr. Thompson, you're more expert in this.
So I'll add, and at first I'll just admit I don't have a great deal of understanding of the specific dynamics here, but the question as it's laid out, actually, one thing that it tells me is that there's a need for a much greater dialogue between these two parties, the healthcare leaders and the local healthcare systems, because there needs to be some understanding and agreement about what should be done and how it, what the expectations are. Because it sounds like in this example, there's a mismatch of expectations, both what should be done and how to do it. And so if there's an opportunity always for some way to come together to develop that common understanding, that actually goes a long way towards resolving this.
And in the developing countries, which where resources are not very not abundant, we often are able to find creative ways to trying to manage, but still within the walls or the rules, and that's where all the ideas flow in. And that's why you also need to engage the team to know your situation, because sometimes they just send demands. They said you are not providing enough of this and this and this, and you should actually be building a good lab, whatever. But on the other hand, if you make them understand, if you are open to them with the situation, with maybe the overall picture of the finances of the hospital, for example, and the demands or the other purposes that you need to do. For example, in our hospital, my director is really good. She gives us illustrations, and when she rejects an idea or a proposal, she will say, for example, that this one will need to cut off the remuneration payments for all the staff. So I cannot do this for now. But later, if we are successful with this, then we might be able to take some of it as a profit to do what we need to do. Yeah, I think communication, again, is important. Yeah.
Thank you. Let's continue to the next question from Sohidad. Leadership is closely related to authority and power. Mr. Stephen, how do you get a leader who has good and effective leadership?
I love this question because right from the start, I have to say, I don't think leadership is related to authority and power. Leadership is related to vision and bringing people together and bringing people along in getting buy-in to that vision, and then leadership being the example of how to help people, help the organization move itself forward. And I think the second part, how do you get leaders that are effective? I think first of all, you have to develop them and you have to choose them. One example that I'll give on choosing, and I've worked with hospitals all over the world, and hospitals still make the same decision. They choose leaders for the wrong reason. There always needs to be an objective basis for choosing a leader for a specific department, for a specific role. What is it that you're trying to achieve? And what I see time and time again is organizations choosing people as leaders because they've accomplished themselves in one particular area. They're the best cancer surgeon in the country, therefore they should lead this hospital. But I would submit that that often doesn't work because that person became the best at what they are by their personal achievement, by things they did by themselves. Leadership in these roles is not about an individual, it's about everybody else. How does a leader get everybody else to move and get the organization to achieve its objectives? Oftentimes, we've all experienced this. Maybe we've had bosses like this or seen bosses like that. Maybe we are bosses like that ourselves, where I've gotten to this position because what I've done. I've worked in the lab for 10 years, or I go to the operating theater every day and I do this or whatever. But as a leader, it has to be about everybody else and about all of us, and motivating and capturing the imagination of everybody to move them towards this vision and towards this objective. So you have to choose. And then the second part of what I said, you have to develop them. We both talked about the need for leadership development, about identifying leaders early on, ideally, and mentoring them, having them learn more about an organization or more widely about the area they're working in, and develop them and help them develop their soft skills and knowledge base to become effective leaders. Great question.
That's actually a very inspiring concept. And I think that makes us think whenever we need to choose a leader, then what is it based on and why are you choosing that person? That needs to be really being thought.
Yeah, I think it's very interesting. Kind of, I guess, yeah, often when we talk about leadership and leader, we think about this authoritative figure, but actually based on our discussions today, it really inspires me and reminds me that actually, we are all leaders. Like everyone here is a leader, and on all levels, we can be leaders and we can make change. Okay, yeah. Do we still have time for questions? Yeah. Do we have questions from the floor still? Yeah, got one here. Please introduce yourself first.
Good morning. My name is Alpha from Center for Health System and Strategy. Maybe I would like a question for both speakers. Mr. Thompson, in your presentation, you mentioned about one of the challenges in healthcare quality is addressing burnout and then mental health awareness. Maybe I would like to ask, could you please share any successful experience or any best practices in encouraging and raising awareness in about mental health in healthcare system or within healthcare organizations? Because I think, especially for younger generations, we're known as the strawberry generation, where we're very mushy and very complain too much, or like we're very, not mentally strong. So maybe I would like to know the best ways or any best practices for you to make, I think, senior leaders to recognize mental health more, but also keeping compliance of the lower staffs, not to make it a loophole to slack or something. And Dr. Aryani, maybe could you please share anything related to that you apply in your hospital? Thank you.
Thank you, Ms. Afa. I think it's very important issue. Also, I think if I'm correct, your question was on about how we can improve awareness, but also on mental health in hospitals and in leadership, and then if you could share some best practices in some institutions you've worked.
Yeah, this is a very difficult question. I definitely don't pretend to be an expert on this, but because I do know that this actually is a worldwide problem. First, starting out with the recognition of mental disease as actually a disease process. Oftentimes it's dismissed and as something else and something that should be dealt with in other ways as opposed to through the healthcare system. I don't agree with that. And I think that actually, best practices in organizations or in countries is really to create a system of advocacy for mental health issues so that these issues are brought out into the public realm so that there's a greater understanding, because it sounds like you might agree that there's so much misinformation and misunderstanding about mental health issues that people develop the wrong idea to begin with, so there's not buy-in. This is actually a problem that needs to be addressed, or that should be addressed by society. So I know I'm answering around your question because I'm really at a loss for the definitive answer, but I would say that it needs to start with advocacy and education, a greater understanding of these kinds of issues.
Yeah, thank you, Mr. Thompson. I think, again, we're coming back to that people are built differently. So they have different background, as we discussed before, different background, different values, and they're coming from different families, and also they are in a different state now among them. Maybe some of them are single, some of them are married, some of them are with 4 children, and some of them might be separated. And we cannot deny that family issues are closely related to their mental state as well. And also there is a workload, burnout, and they really contribute to this mental problem. And this will then turn out as a high turnover rate, usually. We are government hospitals in the Ministry of Health, so luckily maybe it's fortunate or unfortunate, but luckily the turnover rate is not very high because it's not that easy to move or switch between hospitals, right? But you can observe the the staff that are not yet a government employee. You can see that their turnover rate, especially in nurses, are very high. And that's because the workload of nurses are really high as well. And so what we think we're doing in the hospital, I have to admit that I'm not an expert in this as well. But what we do is that we try to give them little promotions. So some kind of recognition at what they're doing. For example, they are first junior staff, and then they are team leaders, and then they can become like the champion for agent of change. And then you can ask them to become the champion for other types of things, a champion for quality. So at the end, sometimes like 70 or 80% of the staff in that unit are all champions in little things. So they are responsible for all their team for something. One is for hand washing or hand hygiene champion, one is for a quality champion, one is agent of change, one is whatever else. And maybe one is like data collection. And so they feel like they have also responsibilities in that particular area. And actually having something and some purpose and some little promotions give them a little hope for the better and give them something to do, actually. I don't know if that answers your question.
Yeah, I guess it's not an easy question to answer, and you said it's a worldwide problem. It's one of those difficult problems, I guess, instead of those easy problem. But yeah, and I was just kind of observing they were kind of trying to answer your question, but kind of going around it. Well, I guess it's because mental health is not easy, and there's many factors around it that affects it,
and maybe because we do not yet have good facility to overcome that potential mental health problem. I mean, we don't have to wait until it is a big problem, but they should have had media to release their stress. And maybe the hospital could provide a psychologist or psychiatrist for the staff who have problems, and they can tell them, or they can get help from the very beginning where it isn't a big problem yet.
Yeah, I guess there's a lot to do on this. But
yes,
yeah, but
we agree on.
Yeah, but I guess we also are aware that mental health does affect ultimately patient safety and patient satisfaction, and that the well-being of our healthcare workers are very important in providing that service. And I guess one thing I can take from our discussion is that we should definitely start listening more and start talking more with all the team members and the frontline workers on how we can improve the well-being and mental health of everyone involved.
Yeah.
Thank you for the great question. I saw there was another person who wanted to ask a question in the floor. Yeah, please introduce yourself first. Thank you.
Good morning, Mr. Thompson, Dr. Aryani, and Dr. Damar. I'm Esterina from Cardiovascular Harapan Kita. I have a question. When health workers are tired, of course, when they are work until 50 or more from they are time work because double shift or other things is takes with caring for and providing service patient until 24 hours every day. And this is question how the leaders challenge of burnout when it occurs, so as not to reduce good service and to reduce patient satisfaction.
Okay. Sorry, I probably didn't hear your question too clearly, but can I just repeat? Is your question on overworked healthcare workers and how we can ensure that it doesn't make our healthcare workers burn out, and also how we can prevent that from eventually affecting patient safety? Is that okay?
Yeah.
Thank you.
It is okay. Thank you.
Thank you. Would you like to start the answer?
Sorry, I might have to repeat it again. Is the question about healthcare worker burnout, overwork? Yeah.
Prevent from affecting patient safety eventually.
So I think that, again, this is a very complex problem, and it presents a complex solution as well. I think it actually starts from some of the things we've been talking about, where first it's the first step is recognize that it is a problem, that that healthcare workers, sometimes healthcare workers project themselves as being invincible, that they can do anything, just give us more, give us more. So getting over that point and recognizing that we're all human and that we have limits and that we have capacities, I think is part of it. And that the work group that we work with, whether it's a nursing unit, a worker in a department or whatever, there needs to be awareness at all levels that this is a real problem for us, that there are unrealistic expectations placed on us every day. And I think the first thing is the opportunity for people to be heard. So we have the obligation to listen to our coworkers, to our leaders, to our workmates about all of the issues that we're dealing with in our daily work life. And quite honestly, sometimes the personal life comes into it as well. So good listening and awareness that this is a problem is really important, I think. And to create an environment that's not judgmental about that encourages people to come forward and express their concerns, their worries, all of that, so that we can do that, so that we can create a more favorable work environment. And the other thing, this is an issue, I know it isn't directly your question, but increasingly there's awareness about the way that patients and their families contribute to this also. You know, people are emotionally very challenged. Sometimes nurses and other unit staff are subjected to violence by patients and their families. We have to create environments that are supportive of the workers and help to understand these very complex and emotional interactions. And it's not about who's right and who's wrong, but recognizing it and understanding that this is an important aspect that we need to be addressing. So it's really about awareness and communication and empathy, things that we utilize in many aspects of our lives.
Yes, definitely. That's really true. And remember, leaders everywhere needs more customers and less staff. So that's the basic rule, actually. But in healthcare, there are some limits to it because we are taking care of people's health. And I think in your hospital, that's even the critical aspect because it's a national heart and vascular hospital. And maybe what we try to do is combining between the seniors and the juniors. That's what we do. So they can take care of more patients when they are together combined. For example, if a junior can only take care of one patient in the ICU, the combination of the senior and junior might be able to take 3, for example, and they are still not overwhelmed with it, because the junior will get guidance, and of course also the combination of the right patient. For example, one patient with ventilator and the other 2 without. So that's how you try to put your strategies around, because I think shortage of the medical staff and the nursing staff and other healthcare staff is always a problem, always, everywhere, especially nursing staff. And one other way is to encourage more and more time for a grouping together, sitting down together and sharing some tips on how to work on things more efficiently, because sometimes the senior ones maybe have some tips on it because they are there longer, and some junior ones, maybe junior staff maybe have good ideas. And so if you combine that, then you can do things more effectively. For a very simple example, I do not sign the documents one by one as they are presented to me. I always do it straight in the file, from the first one to the last one, and fill it out and do it in one go. Why? Because, we have to look again for the file next time, and then we open it again, and then we try to find the page. It takes a very long time. So what I do is I open the file and I fill it out one by one, all in one go, from the very first to the very last one. And I leave some space for the resume, the medical summary, for me to fill out later. But I already have other data, like for the history, physical examination, I already meet the patient. So I fill it out first at the first time when I still remember. And then I will update it or change it or complete it later. It takes saves a lot of time, and maybe all of you have that kind of tips, I'm sure.
Thank you. Yeah, thanks for the example, and thanks for the great question. I guess it is a important problem we all face, especially that we still have a lack of healthcare workforce in Indonesia. And I guess it's really important to have that space where everyone can say what's on their mind, what is burdening them. And I guess kind of nowadays we're talking a lot also about specialist training and how we make sure that juniors and doctors who are in training are also being heard, and especially in this situation where there's kind of impossible work burden. I think it's very important that we, as leaders in all our positions, really listen to everyone involved in the healthcare service. Thank you. We have one more question. Yeah, please introduce yourself.
Thank you for the opportunity. My name Aubrey. I'm from Cipto Mangunkusumo Hospital. I'm a case manager of transplantation. My question: how we can determine our boss as a leader or as manager? Because I feel most leader rule more they do. I read many references that leaders serve by their decision rather rule what they want. Can you explain it? Thank you.
I'm sorry, but I couldn't hear your question very clearly. It's also okay if you want to ask the question in Indonesian and bahasa, and I can help translate if that's easier.
Oh, bagaimana cara kita menentukan pemimpin kita itu sebagai leader atau sebagai manajer? Ya. Kemudian dari apa yang saya baca dan saya lihat bahwa pemimpin itu melayani dengan decision maker-nya dia, bukan mengikuti apa yang dia perintah. Bagaimana Anda menjelaskan ini? Pemimpin itu seperti apa, manajer seperti apa? Karena dalam kepemimpinan yang saya rasakan saat ini, antara seorang leader dengan seorang manajer itu batas-batasannya masih kurang kita pahami, terutama di Indonesia. Terima kasih.
Thanks for the important question. Mr. Thompson?
Yeah, okay. I think it's first of all, it's an issue that's not narrow to Indonesia. It's a problem or an opportunity for us to learn all over the world. So I think managers tend to be in place to carry out very specific tasks. And that's one contrast. We've talked when we were talking about leadership, about visioning, about motivating others, about creating a scenario for other people to succeed, to help put forward the mission of the organization. I would say that's a leader. A manager can also be a leader, but managerial skills are more related to tasks, about carrying out individual activities on a routine basis to complete an objective. But the visioning part, I think, is clearly the distinction between managers and leaders.
Yes, and a leader actually needs good managers because they have these visions, and the manager makes sure that what are planned are being implemented, actually. But not all good leaders are good managers, so they usually need good managers. And maybe specifically in this healthcare quality issue, the manager usually tends to keep things how they are and reject the different the deviations from what is planned. But then this is the role of the leader in healthcare quality. So it's not manager in healthcare quality, but leadership in healthcare quality, because then the leader will say, no, we have to allocate some budget for this because this is important. And then the manager will try to make their way around. So I think that's more about
One example I'll give, and it might be known to you, it was I was at one point working with a GI endoscopy unit that was having some problems, both problems with throughput and problems with equipment availability, the turnaround, because I don't know if you'd agree with me, but endoscopy units tend to want to function like a factory.
Okay, guilty as charged.
Okay,
yes.
Okay. But it doesn't always work that way. And so this hospital that I was working with, they had a safety and quality program that basically matched up senior leaders with specific units, like with this GI endoscopy. So this was a vice president of something else, not related necessarily to GI. So she would come in and listen to the group, and the manager, who had the title but was also functioning as the manager, he said, my job is to take care of, get these 60 procedures done per day, and, boom, boom, boom. He knew exactly what he needed to do. But in this example of trying to improve the efficiency, and there were bottlenecks with equipment because of the turnover, all well known to you, I'm sure. But the manager kept, to your point, kept sticking to it. This is how we do it. This is what we do. We have to do it faster, basically. But the person who was the leader of the group, actually, the leading part of that was not about carrying out tasks, but actually allowing the group to actually break down the whole process, to ask questions about what we do, how we do it, why we do it. And that leadership actually you could see when the manager realized that he needed to think about it differently, that he needed to be a leader also in solving these problems, because he was so caught up in managing, because he had to do all of these tasks.
Right, thank you. It's a very clear illustration of the concept, actually.
Yeah, I think it's very interesting. Kind of on one side you have kind of the managerial kind of, we need to get things done, and then the other side is actually kind of trying to see people see the problem from a different perspective and allow people to actually see that, and kind of and listening and envisioning together how we can make things better. I think that's very interesting. Thank you for the question. It's a very interesting question. We still have many questions apparently on the Zoom call, so let's see a few and try to answer them. Can we get the questions on the screen? Or do we have another question from the floor here? Yeah. While we wait.
Thank you.
So please introduce yourself.
Okay, my name is Oktria. I'm from National Cardiovascular Center Harapan Kita. Maybe my question are for two speakers. Regarding the presentation from Mr. Thompson, I want to ask one question that is about leadership challenge. There is managing resistance to change, so that if we have time limitation for change our community in hospital setting, let's say maybe less than 1 year, so that what to prioritize to change our community to give excellent service for the patient in our hospital. Thank you.
Is the question that you wanted to ask is how we actually drive change in the hospital?
Or what to prioritize? Prioritize
yes,
which changes. To face that challenge about people rejection to change.
So how do we anticipate and how we then react to when we want to make change and some people are not aligned with what we want to do? Is your question?
Yes.
Thank you.
So thank you for the question. I think that both of these dimensions of change are actually examples of where that can be and should be addressed by more effective communication. So first of all, and again, the role of leaders in communicating to actually be clear about not just the objective, but really the creating the mandate that change must happen, and as a result, these are the outcomes that we're looking for. So creating and communicating in a compelling, strong way the need for change. And so that's an example of a kind of communication perhaps that's more one way. But with respect to the development of priorities, I think that's an example of communication that can benefit from more two-way or interactive kind of communication. Again, because the people sitting in the big offices at the top floor aren't necessarily the ones that know what the biggest challenges are or the biggest problems are. So it is really incumbent on leaders to understand and to draw inputs from the broader organization about what the priorities should be, and to have a mechanism to understand what those are, and then within that list of things to develop the priorities. So one is to create the compelling case for change, to describe how it will work, how it's a necessary part of all of our jobs. And then the more interactive type of communication is in identifying those areas that are needed for improvement, for change, for quality enhancement, and then to set out those priorities and again communicate them organization-wide so that everybody's clear. So I answer both of your questions with different types of communication as a responsibility of leaders.
And maybe if I may, if I can add something based on the experience, we were back then not accredited. And then we got a national accreditation and then JCI accreditation. And the challenges was people resisting change. Of course, it happens everywhere. But the main reason why they resist change is that they always ask why. Why do we have to do this? And that why is actually very important, especially for doctors and nurses. Doctors and nurses are, they always ask why we have to do this. But then when you could give them the right reason, just the good reason that they can accept, then they will, even they can be your advocates to the peers. And so I think communication, as Mr. Thompson said, is very important, but you have to put emphasis on the why. That's one. And the second one is giving, again, a little appreciation. And the little appreciation doesn't always have to be something big or a gift, but it could be as simple as giving stars. We printed a lot of star stickers, and we are giving each of them, when we do internal surveys, we're giving stars, the star sticker every time we go. And so then we will count which unit has the highest star. Then we give some small token of appreciation, pizzas or other, just simple recognition at the gathering of overall hospital members. It will give them some proudness, and then they will be motivated to do it better and better. So maybe it could be implemented.
If I could add, because I back to your first point, I think that that's an important role for leaders, and sometimes we call it creating the case for change, to not just say do this, but to tell the story and help the entire staff understand what the mandate is for change, what the benefit will be, perhaps a glimpse into the vision of what the future will look like with this kind of change, to really create that, again, the case for change and get the buy-in that's needed, and to overcome the people who stick their feet firmly in the ground and say no. I'm sure there's a few of those. No one in this room, but other places.
Thank you.
Thank you.
Thank you. Thank you for the great question. Thank you to everyone who contributed to today's session. I think the insights shared by our panelists have been incredibly enlightening. And I hope they have inspired you again to reflect on your own roles in leadership within healthcare. As we conclude this session, I encourage you to take the lessons learned today and apply them in your work to drive excellence and ensure patient safety. Leadership is not just a position, but a continuous commitment to improving the quality of care we provide. I'd like to leave you with a quote by John Quincy Adams. If your actions inspire others to dream more, learn more, do more, and become more, then you are a leader. Let this be a reminder that each of us, through our actions and dedication, has the power to inspire change and lead the way to a better healthcare system. Thank you all for your active participations, and a special thank you again to our panelists for sharing their expertise. An applause again. Wishing everyone continued success in your efforts to enhance healthcare quality. Have a great day ahead. Thank you. I'll give it back to you.
Thank you. Well, Dr. Damar, Dr. Aryani, and Mr. Thompson, would you mind to stay on stage because to accept the certificate, and then we invite to join with us in the stage Ibu Dwi Melani to deliver the certificate. Okay, ladies and gentlemen, once again, big applause to all the awesome people and all the stage. Thank you. Well, Ibu Dwi Melani, to Dr. Damar and all the speakers, please take your seat. Well, ladies and gentlemen, we will continue with group photo session. So I invite all the participants to step forward. Silakan maju ke depan. Kita akan foto bersama sambil izin mau sambil berdiri atau duduk? No. Jadi fotografer akan ngambil foto dari depan. Untuk partisipan duduk atau berdiri? Berdiri, oke. Silakan Bapak Ibu untuk berdiri. Kita akan foto bersama. Oke, once more. Oke, thank you. Baik, silakan Bapak Ibu untuk kembali ke tempat masing-masing. Okay, next, I invite to join on stage from Assessor Global, from team Assessor Global, Dr. Maureen Lewis, and then Ibu Dwi Melani untuk foto bersama. Silakan. Saya juga mengundang. Okay, I also invite all the team from Assessor Global and then Mr. Thompson and team to join with us in group photo session in front of the stage. Okay, and I also invite all the committee to move, to step forward to join in group photo session. Again, to all the committee from P2 KSN, maybe to join with us. Okay. Okay, thank you. Please take your seat. Ya. Hadirin yang berbahagia, tibalah saatnya kita pada penghujung kegiatan kita pada hari ini. Terima kasih atas partisipasi dan kontribusi yang telah diberikan. Kind reminder, untuk klaim sertifikat, para peserta dapat mengakses pembelajaran dan mengisi post-test melalui KMS kelas Kemenkes Korpu. Link tersedia pada multi-link yang telah dibagikan oleh panitia. Thank you for your time and attentive ear. May success follow you for and dear. Saya Andre Rahman, pamit undur diri. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Baik, selanjutnya kita akan masuk ya untuk sesi pemberian hadiah. Akan ada hadiah untuk 3 penanya terbaik, benar begitu ya? Untuk itu mungkin kepada Dr. Damar mohon kesediaannya untuk memilih 3 penanya terbaik. Baik, mungkin saya butuh bocoran dari panitia siapa kira-kira 3